Sometimes doing less is doing more. So this is one of life's lessons which holds so true and is so apt for the field of hair restoration surgery. When a patient comes to us who is young, who has extensive grades of baldness, we need to plan for the coming years. Because we do not know which way the camel will turn. How deep is the genetic penetration of the baldness gene? How the baldness will evolve. A patient might have grade 3 baldness at say the age of 28. It may seem that the other hair are all very good. There is no miniaturization in the donor. But as time progresses, the patient goes into grade 4, grade 5, grade 6, and sometimes even grade 7 baldness.
And I turned all gray. From my mom.
So there are many imponderables that a hair transplant surgeon is working against. And to try and do all grafts in one session, as is becoming increasingly the norm today in the hair loss industry, I feel is playing with the patient's emotions and the patient's future goals and objectives. The patient is not mindful of this fact at this age of his life. If he's 25, 26, he wants all the hair that he can get at that particular moment because he thinks, as per social norms, he needs to have a head full of hair at this very moment when he's youthful. He does not care for the future. He thinks that it's only during this part of his life that he will need to have hair, and that later on when he gets married, when he gets children, most people feel that they will not have the need for a head full of hair. And it is so far from truth, because a hair transplant is done not only to tide over your social issues in early adulthood, like finding a partner for yourself or for dating. For body image is the key reason why people get hair transplants done. And this body image, as you age, body image issues continue to evolve. And I have patients who are even 70 years old, and because of their body image, they want to maintain the body image. Many times patients have had divorces, they're looking for another partner, and they want to have a head full of hair even at 60. I get patients even 75, 80 who want a hair transplant done. It's pretty normal. Age is not a criteria for a patient wanting to look youthful and young. And there is another coterie of patients who have issues at place of work, who are ambitious about their promotions, about climbing up the hierarchy of their corporate jobs. And with so much of competition that they get from youngsters, they need to look youthful. So it is not only that you want to have hair when you're young. The need to have hair and the need not to look bald will always be with you throughout your life. So to throw your future goals and objectives to the wind is not a very rational thing to do while seeking a hair transplant. You take, for example, this patient. He has a grade 5, or you could say grade 4 baldness pattern. Many clinics, if you sent this picture to them, would say they need 6,000 grafts, no less than that. Clinics which are more circumspect about their ethics, about their public profile, will say the patient needs 4,000 grafts and an additional 2,000 will be taken from the body, the beard, the chest, and other areas of the body. So hair restoration surgery has over the last 5 years taken a bizarre turn. The quotations you get for grade 4 and grade 5 are upwards of 5,000. We are not waiting for the gene to express itself. We do not know where the next balding will occur. We do not know how much the crown will expand, and we are giving full density in the center. And as the crown expands, how will we, for God's sake, cover the area which appears around the fringes? Will we be able to achieve the same density as we did in the center of the crown? No, this is not possible. So rather than wait for the camel to turn, so we can decide on how many grafts are required in future, more and more patients are becoming party to breaking the camel's back, playing merry hell with your future goals and objectives. The norm today is to do more and more grafts in the span of 25 to 30 age group. So if in this patient I had done 6,000 grafts, I would have no other areas left. I would not have known where he will need more grafts in the future. So this is not the way to plan a hair restoration. The initial time the patient comes to you, the patient should be assured of the need to do less grafts and have some grafts handy for his future needs. And this was what was done in this patient. This patient initially received about 3,500 scalp grafts for his grade 4, grade 5 male pattern baldness. And after a couple of years, he came in and he required a little touch-up, which was done. And now after the lockdowns are over, he is planning to come in for a third hair transplant. This he would not have achieved had we done 6,000 grafts in the first session. Large number of grafts, though may be imperative for commercial reasons for the clinic, but they defeat the future goals and objectives of the client. So this is the lesson from this video. If you like the video, do let me know. And if you have any questions about hair loss and hair restoration surgery, I'll be too happy to answer your questions. See you in the next video. God bless you.